My name's Allie.
Holly?
I'm Megan.
Anna?
Okay. We're going to be discussing cholera in Haiti. So, prior to the 2010 earthquake, there was already a big problem with sanitation in Haiti. There was really a lack of sanitary infrastructure in Haiti. A lot of Haitians that have latrines rely on Baiacu to clean them out. And it's really this rudimentary kind of system where laborers go in by hand and clean out these latrines, which are basically just cesspools, and move the waste to a different location. So it's really not the best system, but it's certainly better than nothing, which is what a lot of Haitians do have to rely on. They rely on systems of open fields or canals to put their waste. After the 2010 earthquake, there was a huge foreign aid response, $13.5 billion, which is really unprecedented. But it's important to note that that money didn't necessarily go to cholera, because cholera wasn't really on the scene until 10 months after the earthquake. Before the earthquake, cholera wasn't really an issue in Haiti, and it hadn't been an issue for about a century. Cholera was brought to Haiti by UN Nepalese peacekeepers who arrived to deal with the devastation from the earthquake. The Nepalese peacekeepers brought the disease from their former location, and through a really poor system, they put their waste into the main Haitian river, the Artibonite, and that just spread throughout Haiti, and it just really caused cholera to explode on the scene. Because, as I said, Haiti was already really primed for an epidemic. Originally, the UN was really unwilling to admit responsibility for cholera in Haiti, but through a lot of direct evidence, it was shown that the cholera strand in Haiti and the cholera strand in Nepal are the same thing, so clearly the UN is to blame. However, very recently a lawsuit has shown that the UN is not going to be responsible to pay damages to the victims of cholera. They're pretty much immune from that. That's not to say that they haven't raised a certain amount of money to deal with cholera, but it's absolutely not enough that's necessary to deal with this extent. And a lot of donor nations and NGOs in general are pretty unwilling to put money directly to Haitian organizations because there's a lot of political turmoil that exists in Haiti right now, and so they are more interested in keeping these funds in their own organizations for the purpose of security so that they know what the money is going to. But that's not the most efficient method necessarily, because oftentimes a foreign organization will come into Haiti, or just into any country really. It'll be at least 3 times more expensive than using local organizations to implement this money into some sort of system.
Okay, so now we're going to switch gears and talk about the strain of bacteria, B. cholerae. And so originally, back when they're trying to figure out the origin, they thought, well, maybe by analogy with the cholera epidemiology in South Asia, maybe just like that in Haiti, the weather conditions could have produced a natural development of this strain of bacteria. But like Ali said earlier, they figured out that really it was an importation of the strain from the UN Nepalese soldiers. So the bacteria is a gram-negative. Only some strains cause cholera. It's a facultative anaerobic bacteria, which means that it can make ATP when there's oxygen around, but when there isn't, it can still function and make ATP through anaerobic respiration. There's a flagellum at one cell pole, so it makes this bacteria very suitable for water habitats because it can swim around. To identify this bacteria, you would culture a patient's stool sample, and that's when you have a lab setting. But in many places, of course, there's no lab setting, so you can use a product you can get. It's called the Crystal VC Dipstick Rapid Test. And This rapid test is less reliable than the culturing of patient stool samples, so it's better to culture it. Symptoms of cholera: you get diarrhea. It's dangerously sudden, so you have quick fluid loss. And the diarrhea is a pale, milky appearance, so any description of it is like a rice water. You also have nausea and vomiting, and that can persist for hours at a time. And all of this results in dehydration, which can give you electrolyte imbalance and resulting in muscle cramps and shock. And this is when your blood volume drops, and so does your blood pressure, and then therefore you have like a lack of oxygen throughout your body. So the spread of cholera in Haiti was super quick. So the reason for this was because of the original inappropriate waste disposal in the main river that's like very commonly used for washing, bathing, drinking, and recreation. And so many people were exposed to cholera. Thousands of patients are exposed to the artemiside river water, like in the rice paddy fields, and the canal system and the delta provided optimal environmental conditions for rapid proliferation of the bacteria. The population lacked immunity to cholera, and like we said earlier, many areas of Haiti suffer from poor water and sanitation conditions. Also, after the initial outbreak, infected individuals fled to their home communities, and this process helped disperse the disease. And then infected individuals would concentrate where treatment was available. And then this specific strain caused more severe diarrhea. And then finally, the conditions in which cholera patients were initially treated in medical facilities didn't help the prevention of the spread of disease. So all these reasons contribute to why cholera was so rapidly transmitted.
So far it's affected over 700,000 people in Haiti and over 9,000 deaths. Most of the deaths are adults. It's about 40% children, but the population is around 10 million, and that's 40% children. Most of the population is under the age of 15, so obviously there's a big concern for loss of parents and orphan children. And these are some pictures. That's a family member dragging their dead mother through the street. Solutions. So basically the major problem with the spread of cholera is access to clean water and sanitation facilities and poor hygiene practices. So we propose a major infrastructure development. It would cost billions of dollars, but the Haitian government, along with the CDC and the UN, have already planned this call to action, which is $2.2 billion for sanitation and sewage facilities and piping and clean water locations, but only a fifth of it is what's needed for total construction of this facility for Haiti. It's called the WASH program, so it's sanitation, healthcare services and management, epidemiology and surveillance, and health and hygiene promotion. So all of this would go together to promote clean water practices and hopefully prevent the spread of cholera, but again, it's a big problem when there's no clean running water and toilets. I mean, there's only one toilet for 1,500 people in the most crowded places, so it's a big problem.
And we understand that it costs a lot of money to make this infrastructure and a sewage system, which they don't have. So some shorter term and cheaper solutions would be the Q-drum, which it can pull about 50 liters of water, and such people like kids can pull it, so it's pretty easy to pull across long distances. So it can hold about 50 liters of water, and so if you have access to clean water somewhere else, you can take it to a place with less access to clean water so that people don't get cholera. And then the other cheaper version is the life straw, which actually has been used in Haiti, but with more money we can get more, and it doesn't even cost that much. It's $3, roughly $3 US, and it filters water right from consumption. So like you have dirty water, it'll filter it, and it kills about 99.99% of the bacteria that's in the water. Yeah. Here's our references.
Any questions?
Come on, folks, participate.
All right then.
You're too busy writing. My fault.
Have they done some of these things to fight this in Nepal, or is it as widespread of an issue there? Like, it came from there? Other things that can be taken from?
Honestly, I don't know that much about cholera in Nepal, so honestly, I can't answer that for you.
Yeah, but the problem with Haiti is that it got so bad because of the poor water and sanitation facilities there. So, yeah.
I guess, what would the average cost be if you were to get enough life straws to try to ration out to the whole community? Or do you guys have any idea? Because I know they're not really expensive.
For the entire country and distribution, I mean, it would probably be at least $1 million or more. But that's not really the best long-term solution. We want, better sewage facility.
Yeah, because you have to have education
Yeah.
too, how to use them.
Do you know what the utilization rate is right now?
For the election,
Yeah.
there's like 1,000 liters for each one, so then I don't know how many.
We're not sure
now
how much they're used.
You have a life straw user over there.
Had to test it first before putting it out the straw.
To what extent do you think that education will be an issue in this situation? Does everyone there pretty much know that the water is contaminated, but they just don't have the resources to fight it? Or is there going to need to be an education initiative teaching people that, yes, the water, there's really bad stuff in the water, it will kill you?
That's a good question. Education, to a certain extent, education is an issue, but even if they're educated, if they don't have another alternative, then they're going to continue to use the water.
Yeah.
So if you improve the infrastructure, then that just solves all.
I think there should be like an education on like not, using the river water as where you like dispose of your waste. So I think it's like you can bury your waste or just use some other form of disposing. Yeah.
Yes.
Is there anybody working on cleaning the water? Not like the river? Or
I think cleaning up a river to that extent is somewhat expensive, and I know that there are some organizations that have made an effort to do that, but it's so expensive that there are better solutions at the moment that I think people are doing. Yeah.
Is there any treatment for people who do get cholera?
Cholera isn't necessarily a deadly disease. A huge amount of patients have contracted it, and not all of them have died necessarily. Getting treatment is another issue that needs to be addressed.
There is a vaccine, but again, it's like in limited supply, so that's also another problem.
All right, thank you.